Welcome to Mental Health Monday, Check-ins with Jamie Lynn. I am Jamie Lynn. This week, I am talking about trauma response. Trauma response is the way that you react to trauma, either during the traumatic event or after. It looks different for everybody. However, we all will fall under one of the four categories of traumatic response. There's behavioral, emotional, somatic, and cognitive, and then sometimes you will experience a mix of those trauma responses. Like I said, it looks different for everybody. You could have a cognitive response one day and an emotional response the next time that you're triggered. If you have experienced a trauma, please talk to a licensed mental health professional so they can help you work through it and help you breathe through it and help you learn some healthy, keyword, healthy coping skills. Because that's what it's really all about. We all experience life differently. We all come away from different incidents and situations differently, but having healthy coping skills in our mental health toolbox will benefit you in the long run. So if I am talking about something and you're like, oh, that sounds familiar, talk to a licensed mental health professional. Okay. So anyways, part of moving through and figuring out your trauma response and growing and getting past your trauma includes triggers. You got to figure out what your triggers are. And a trigger is just anything that can take you back. Okay. It could be a sound. For many veterans who suffer from PTSD, the sound of a car backfiring could take them right back to war if they've experienced war. And that's part of their PTSD because a car backfiring sounds like gunshots. It sounds like artillery. And so just that sound can take them right back and trigger their trauma. Smells. There's lots of smells. I am a person who a lot of my memories are formed with smell. I have one. It's not trauma related, so it's not a trigger, a negative trigger or a trauma response. But for me, I use essential oils for all kinds of things. I've done videos about that. Anyway, so I remember the first time I got my bottle of spearmint essential oil. I opened it up and I took a big whiff and immediately a memory from my youth just hit me with a ton of force. I was not prepared for this. Okay, so my maternal grandmother passed away when I was 4. It's pretty young. I don't have any core memories from that young. You might, but I don't. However, I remember, and I've been told, so it's kind of part of a real memory and part of, stories that you've heard about your youth or your past that you kind of turn into a memory. I know that my grandma chewed the double mint spearmint gum. So when I opened that bottle of spearmint, I was suddenly 4 years old and either playing with a pack of gum or a wrapper, but that smell took me to my 4-year-old self and my grandma. And it was so overpowering. I had tears in my eyes. I called my mom and she was like, whoa. But so anyway, smell can trigger positive memories, general memories, or it can trigger a trauma response. Certain colors. If you experience a traumatic event at the hands of a perpetrator who had, say a red jacket, the next time you see a red jacket, that could trigger you. You could freeze. Your brain can shut down. You can go through one of those traumatic responses just simply by seeing a red coat because that was part of your trauma in the past. There's so many different ways that you can be triggered. It could cause flashbacks and distress for sure. If you can learn how to identify those triggers and develop healthy coping skills, you can start to move past. And then that way, every time you smell that scent or see that color or, hear that sound, it's not going to automatically trigger that trauma response. Okay, so I'm going to dive in just a little bit beneath the surface of the 4 trauma responses, just so you can understand. And again, if you if any of these sound familiar to you, talk to a licensed mental health professional. Okay, so behavioral trauma response looks like self-medication, right? Engaging in high-risk behaviors, avoidance of the trauma all together, and then self-harm. Those are all behavioral trauma responses. Okay. Emotional dysregulation is another trauma response, and that's your inability to manage intense emotions. Right? It's you all of a sudden go numb or you feel overwhelmed and your emotions are just taking so much out of you that you just can't react. That is emotional dysregulation. Okay. There's the somatic response. Somatic means the body, right? So chronic pain, illness, difficulty sleeping, extreme fatigue, exaggerated startle response. That's part of a somatic response. That's your body responding to the trauma that it has experienced. Okay, teeth grinding, dizziness, there's a whole host of others. You can Google that. And there's a new therapy. I don't know how new it is. New to me, it's somatic emotional regulation. And I said that wrong. It's somatic response therapy. It's very interesting. There's a lot of research to support that. Check that out if it's something that you're interested in. And then the cognitive response, right? So that's your brain. That's how you react with your brain. So one day you're fine. You feel safe. You feel secure. Everything's going well. And all of a sudden the next day, bam, right? The whole day feels like it's posing a threat against you, and you don't want to leave your house, or you don't want to do certain activities. You don't want to answer your phone, because your brain has just shut down, right? And it cannot respond in a healthy manner because of your trauma. Okay. Intrusive memories can be part of a cognitive response. Guilt, shame regarding your trauma, trauma-induced delusions or hallucinations. That's a cognitive trauma response. And then idealizing perpetrator behavior, right? When you start to allow your brain to gaslight you and you're like, well, this happened to me, but it really needed to happen. Or you just start to you just idealize, the person or the event that caused the trauma. And that is a cognitive response. It's completely normal. However, again, talk to a licensed mental health professional. If any of those touched a nerve with you, if all of them touched a nerve with you, I'm not trying to trigger you. I just want you to recognize, okay, oh my gosh, maybe I did experience trauma and I minimized it because 2 of these sound like something I'm going through and I didn't even think about it. Talk to a licensed mental health professional so they can guide you through your trauma, your traumatic event, so that you can develop healthy coping skills to work through it and try to get a healthier mental health. All right. Hang in there. I'll talk to you next week.